Medicare. Okay, this is a big one. It's so big that it's so important for our clients that we didn't actually do, so we always did the Medicare seminars, Medicare planning, but it seems like there's so many questions about it all the time that we actually started doing the Medicare plans for clients. We actually do the Medicare Advantage and the Medicare Supplement plans now because that's the easiest way to answer the specific questions. So for people 65 and older and those with disabilities, citizens, legal residents, those who have worked and paid Medicare taxes for 10 years to get those 40 credits like for Social Security, and who have lived in the U.S. 5 years in a row before enrolling. Initial enrollment period is the 7 months around your 65th birthday. If you're already receiving your Social Security, then we'll be automatically enrolled in Part A and B of Medicare. If still eligible for a group healthcare plan at your employer, you do not have to apply for Medicare until you retire. Obviously, you still apply for Part A because it's free of charge. You don't pay a monthly premium for it, but you don't have to. You wouldn't, a lot of folks don't apply for Part B. If not covered by employer plan and do not apply during the initial enrollment, 10% lifelong penalty for every year you are late to enroll. Okay, so very important there. General enrollment period is the first quarter of every year with benefits starting the following year. So if you missed your initial enrollment period, the general enrollment period, first quarter of every year. Medicare continued. Part A is hospital insurance. Again, it's no cost. Covers rooms, meals, nursing services, equipment, an operating room. There is a deductible with this plan. It's fairly low, about $1,600 or so. Part B, medical insurance. Substantial cost during retirement. Premium, deductible, copay, or 20% coinsurance. This is very similar to what you have if you have the insurance through your employer. So it pays for doctor visits, services, outpatient care, clinic visits, emergency room, ambulance, preventative care, medical insurance. Part C is the Medicare Advantage. So this is where if you're not satisfied with Medicare specifically, and again, my mother has Medicare Advantage, and I just moved her up from Florida, and now we're switching the plan because they're more area specific, and to a Medicare Advantage here in this area because she likes the extra benefits. Like first, you get extra spending money every quarter that you can spend on, for instance, not over-the-counter medication and other medical supplies and so forth. You can get Uber rides to the doctor, and all that's included. So that's something that Medicare Advantage does. It's private insurance and may or may not have a premium. So how it works is you forego your Part A and Part B and you just get Part C instead. Covers everything Part A and Part B and covers and more. Has other benefits. Often includes benefits not included in Medicare, as I just discussed. Has a network. So the great thing about Medicare is everybody takes it, pretty much. These Medicare Advantage plans, though, so when we run these calculations for clients, Medicare Advantage, you have to make sure that the doctors you like, because everybody has their favorite doctors usually, you make sure that those doctors are on the list of the network where the Medicare is, just like your regular insurance. You want to make sure that everybody's in the network that you like working with. Prescription, Part D is prescription drug coverage. Same thing, when you're picking so if you have a prescription drug plan, when we look at these for clients, we're specifically putting in their medications and dosages to make sure that the plan that they're getting has the best coverage for their specific medications. There's so many plans, it's unlimited out there, so you want to make sure that you're catering your situation properly. So there's different classes of drugs. There's a premium and a copay, and there's tiers 1 through 6. Higher the tier, the more expensive the drug covered, and the more potential out-of-pocket. Medicare supplement plans, Medigap plans, help pay some of the out-of-pocket costs. So this is where, if you got Medicare Part A and B, and you didn't want to get rid of those, you wanted to just add on to that, more complete coverage, this is where you get the Medigap plans. So it's Medicare supplement plan. Now, the good thing about these plans is anywhere that Medicare is taken, Medicare supplement plan is going to cover that doctor. So there's no network issue there. No network, no referrals. Letters A through N. All of this. So all of the plans of the same letter provide exactly the same coverage, but may differ in what they charge. So there's an extra charge for this one, whereas for Medicare Advantage, there's usually no extra charge. So Medicare Advantage is very popular. But around here, where in general folks have a little bit more money, often these supplemental plans are also quite popular. Plan G, G high deductible, and N are the most popular just because they're most comprehensive. Most Medicare participants, so if you want to know what most people do, they choose Part A, B, and Medigap, as well as Part D. So enroll during Medicare enrollment period or will have underwriting. So we're talking about these Medigap plans. So you want to enroll right away as soon as you become eligible, because you don't want to have underwriting, especially if you have health issues, obviously. You want to do so there is no underwriting. Medigap plan comparison chart. So we're talking about Plan G. So Plan F is no longer available for most people because it was so comprehensive that the government felt like, well, the money is not being spent wisely if everything is just almost free. So now the next best plan is Plan G. It has some deductible still, but it covers everything else pretty much. And the big thing is foreign travel. If you like to travel abroad, Medicare is not very good about covering those charges. And a lot of folks like to travel abroad, obviously. And so they want to enjoy their retirement. And so foreign travel so these plans are nice about covering the foreign travel, and so are the Medicare Advantage plans. What does Medicare cost? So obviously Part A is free, we discussed. Part B premiums are decided by your income. Most folks are in this area right here. And we're looking at 2 years back. It's 2-year look back for your income to decide how much you're going to pay. If you're filing individually, $103,000 is the cutoff for your monthly premium being $174.76. It goes up from there, or 70 cents. It goes up from there. For couples, if your income is less than $206,000, then you're going to pay this amount per person. So most people end up here, but then it quickly goes up from there. Federal employee health benefit. Most folks really like their federal employee health benefit. They don't get rid of it. They add things onto it. 72% of that benefit is paid for by the government. To be eligible for federal employee health benefit in retirement, you have to be eligible for immediate retirement, meaning eligible for pension at retirement. And you have to have been covered by the federal plan for 5 years, for the last 5 years prior to retirement. So there's several ways that folks strategize around their federal benefit. Option 1, to have lower premiums, but you pay higher out-of-pocket. Enroll in Medicare Part A only. So your inpatient bills, Medicare pays first, and then the federal plan pays second. Outpatient bills, only federal plan pays for that. Option 2, higher premiums, less out-of-pocket. Enroll in Medicare Part A and B and keep the federal plan. Medicare pays first, the federal plan pays second, all expenses. Option 3, and this, if you do this, you can never go back to the federal plan. You enroll in Medicare A and B with Medicare supplemental plans, so like the Medigap plan. G or N usually is what people pick. All bills Medicare pays first, supplemental plan pays second. Option 4 is you can suspend your federal plan and then go back to it if you change your mind. Enroll in Medicare Part A and B with Medicare Advantage plan, Medicare Part C. The insured pays copays, the Advantage plan pays the balance.